As pointed out by Professor Jamal, last year was a challenging year for the healthcare workers, healthcare institutions, health services, economy, and food industry. Moving forward in the COVID pandemic, turning difficult time into opportunities, this topic, Dr. Professor Jamshid asked me, it is a difficult topic. Everybody, we are daily discuss about the COVID. I dedicate this presentation to those healthcare workers who lost their life during the COVID crisis. The mission of our hospital is to provide optimum healthcare provision in the COVID era, to act as a model institution to alleviate the suffering of children, to educate the healthcare professionals and public, and to conduct the research. Next. The objective of this presentation is to discuss the challenges and to discuss the strategy to deal with these challenges and to convert these challenges into opportunities. Next slide. Next. You know, till now, total 120 million people all over the world, they suffered from the COVID. And among this, 2.6 lakh represent the areas where the COVID gave a serious challenge. This is indicated in red, and the most least affected areas in the green. Next. And economy in 2020 were on the negative side. And this is the prevention strategy which is practiced by all of us. Next slide. And this COVID has led to a dramatic loss of human life worldwide. It gave us an unprecedented challenge to the public health, food and economy. And economy and social disruption is devastating. Tens of millions are at risk of falling into poverty, and majority of lack the social protection and access to quality health care. Next slide, please. And these are the challenges which is faced by our institution at the start of COVID-19 in February 2020. And the next problems identified were problems at the level of human resource. This was a serious problem. At that time, everybody was confused, and the people were electing, healthcare workers were electing to do the duty in Corona. And challenge at the level of infrastructure, we are not prepared to deal with this. And logistics, supplies, drugs and equipment, this is seriously short. Laboratory services, we have not the facility of PCR. Protocols about the COVID were not defined. Stoppage of routine work in hospital and piling up of the patient in the institution started, and it created a lot of problem for the future. And one of the problem at that time was, as there was lockdown, the healthcare workers were unable to reach the hospital. Transport or staff to the hospital was another challenge. Next slide. Healthcare system was in a heartache, and workers have to do the long working hours, fatigue and extreme psychological stress, psychological distress, anxiety, depression, stigmatism, and diminished quality of life. Post-traumatic stress was also there. And this indicates the total involvement of healthcare workers in May 2020. It was 1,52,000. Next slide. And among this, at that time, 1,413 lost their life. Next. And in the children's hospital, this is the staff who suffered from corona. This is officially documented whose PCR was done in children's hospital at that time, till now. But the number was much more. Many people did not like to be tested, and many do not conform to this institution. Next slide. And reaction from the healthcare workers was very much problem at that time. Doctors Association created the problem. Nurses Association also appreciated the issues, demanded and stressed on PPE, and training of the doctor. This was a genuine demand by them. Everybody was confused at that time. UTR's readjustment, many doctors absconded and left. Many ad hoc doctors resigned. Strikes started and they blocked the secretariat. Response was sometimes more exaggerated, and the greater risk to the healthcare workers may be due to their own colleagues and patients in early stage of unsuspected infections, especially to the surgeons who have to operate in emergency. Next slide, please. These are the on-strike doctors. They occupy the secretariat. They are sitting in the secretariat. Next slide. Challenges at the level of infrastructure in the initial time. We are not prepared to compete with the corona. We have not negative pressure rooms. We have not isolations. We have not ICU and HDU for the corona. And we have not the PCR laboratory. And there are so many things which has to be changed at that time. Next slide. Supplies. About the logistics, supplies, drugs and equipment, we were seriously in shortage of this equipment at that time. We have next slide. We have this amount old stock. And our daily consumption at that time was like that. And lack of laboratory PCR services, as already highlighted, and other tests like D-dimers, serum ferritin, a specialized separate laboratory was required for this, as you are unable to do these tests in the normal laboratory. Next slide. And the most important and the missing thing was protocol about the COVID-19. Nobody knows about it. It suddenly hit. And textbook was deficient on this COVID literature. No COVID literature available in the start. Vague guidelines, confusing literature, panic situation, no handbook. Everybody was mastering telling about the management of COVID, and all are in the lack of managing it. Next slide. Stoppage of routine work in the hospital, filing of the patient. Certain departments like ENT, eye, dental were closed. Periphery hospital, they left work, and every patient was referred to the center. Our hospital was under severe stress, and intercity transport was stopped. One of my staff, she was coming to duty on motorcycle from outside Lahore, and she lost her life during the transport. Next slide. As public transport was stopped at that time. So we have to lay down a framework for to compete with this challenge, and our priority was the health first, protecting our people, and basic health services. Economy was the duty of government. Next slide. Leading from front, the ultimate measure of a man is not where he stands in moment of comfort, but where he stands at the time of challenge and controversy. Next. You have to lay down a certain strategy to complete this challenge, and we lay down this strategy. This is in well accordance with his strategy. Next slide. And someone has to play a leadership role. Me and my dean, Professor Masood Sadiq, we have to play a leadership role at that time. Leading from front, the ground realities are harsh and might create panic among the employees, created the panic among the employees, suppliers and customers. The situation posed an adverse challenge for us in 2020. It was almost like a game that could not be won. This was impression in the beginning. In short, leadership demands were of unprecedented nature. Thus, uncertainty embedded in this situation made leadership challenge. So we took the control of entire situation, and we have to do certain hard decisions also. Next slide. The leadership dilemma, employees were demotivated and fearful of worst. We should assure them that they are safe. This may not be area of our expertise at that time. We need to encourage them, our employees. Next slide. And in the midst of chaos, there is also opportunity. Next slide. Next slide. Next slide. COVID crisis are also an opportunity, and we have to convert it into opportunity. Next slide. How to deal with the COVID-19 crisis at Children's Hospital Lahore? We met this challenge by doing all which we will discuss in the next slide. In the making a team, we made our team, our faculty, we called our faculty, and they stood with us. We motivated our nursing staff, paramedics, board of directors, philanthropists, of course, government, and formed different committees. The first steering committee was Faculty and Academic Council, then Corona Management Committee, then Protocol Development Committee, Surgical and Medical, Psychotherapy Giving Committee, Donation and Finance Management Committee. Next slide. We changed ourselves according to the need and demand at that time, and remained on the front of frontline workers, with the frontline workers throughout the COVID. Me and my team, we never went from the institution. We always came on the 8th and went home on the 4-5. My Mrs. Saleem, she was always demanding, why are you taking so much serious challenge? But we have to be on the front line workers. Effective health communication is the need of day, and we use this technology for motivation of our healthcare workers. We spent our each year, motivated our healthcare workers, and so we were able to meet the demands at that time. Next slide. The committee, this committee was formed to lay down the protocols in general and especially in the medical. They motivated the doctors and the requirement, they laid down defined the requirement and laid down the roadmap to cope this situation. And the man on this photograph on the other side is Professor Ali. He was just to retire at that time. 3 months were left, but he is the man who is a very big gym. He stood on the front. His two sons were working in America as a doctor or as a frontline worker. He was under great stress, great stress, but he stood like a lion, and he was the man who helped us to manage the patients. Next slide. And we made another committee under Professor Nabila Talat's leadership to define the requirement in new dimension, develop surgical protocol, new theatre requirements, and emergency management. And she performed his duty to her utmost honesty, and ultimately he suffered from corona. My 60 to 70% of team, surgical team, they suffered from corona. I salute my resident. They never asked me, we need PCR to operate the patient in emergency. They continued to operate the patient from February till now without PCR in emergency. I am proud of my resident. Next slide. Protection of healthcare workers, safety of the staff. Me and Dean started communication campaign with the employees to understand their changing priorities, acknowledge them, and safeguarding mental, emotional, and psychological health and safety of employees and stakeholders was our top priority. Half of the workers were sent home, half were present in the duty, relaxed the roster, and office workers were asked sometimes to do their duty from home. Next. We provided them psychological support and helped them to deal this situation next. And we formed a committee under the leadership of Professor Shazia Makhool, who always remained in touch with those who suffered from corona. Me and Professor Masood Sadiq, we always bring the man who suffered from corona from among our healthcare workers and always talked and motivated. Next slide. With our staff. Next slide. Psychological support committee worked a lot. Next slide. And we acknowledge their devotion for the work. This man who was speaking in the video, Saleem. He was the first man who devoted himself to perform the first duty. On the first day when the patient of corona came, there was एक सन्नाटा छाया हुआ था चिल्ड्रन में और वाइडली हमें कर रही थी कि हमारे पास है क्या, हम कैसे मरीज को डील करेंगे, बट ही कमिटेड एंड ही डिड हिज ड्यूटी एंड द स्टाफ, वो इसीलिए हमने उसको साथ में पोजीशन दी थी. ये दे वर द वन हु वॉलंटियर्ड टू डू दैट. नेक्स्ट स्लाइड. नेक्स्ट स्लाइड. Challenge at the level of infrastructure, we started working on this. There was no purpose-built isolation, HDU or ICU. We do not have fever clinic, and we have not negative pressure rooms for keeping the patient and preventing the spread of infection. Do not have purpose-built operation theatre for corona. No corona laboratory. Next slide. And then we made these all things possible by changing the infrastructure. Fever clinic was established. Next. Trial area was defined and established emergency trial area. Development of trial deal with the COVID. Next slide. Established our 40-bedded COVID area. 15 bed for isolation, 10 bed for ICU, 15 bed for high dependency for the COVID. And the children hospital was the one who was dealing with the children suffering from COVID at that time from all of the North Punjab. Next slide. Next slide. Next slide. Next. HVAC system. This was a serious challenge. My engineers do not know anything about the HVAC system of Children Hospital Lahore. And आप जानते हैं कि उस वक्त कहते थे कि अगर सेंट्रल एयर कंडीशनिंग चलाएंगे तो सारा हॉस्पिटल सफर करेगा from infection. This will spread. And I have to study this myself. I studied this, and we changed one of our theatre to negative pressure by changing the incoming and outflow pressure, shifting majority of the inflow directly from outside. अगर आपका एयर कंडीशनर रीसर्कुलेट करता है, जैसे आपका कार का भी करता है, रीसर्कुलेट करता है, for prevention it is needed that once through system should be opted. That we opted this. Next slide. स्प्लिट एयर कंडीशनिंग कोविड एरिया जब सेपरेट किया तो हमारा ऊपर वाला सेंट्रल एयर कंडीशन स्टॉप हो गया, कोविड एरिया में एसी देने थे. वी कलेक्टेड अ बिग डोनेशन फ्रॉम आवर फैकल्टी. Nearly 75 lakh was collected from our faculty, their relatives and donors, and 110 air conditions were installed in the COVID area and rest of the area. Next. Logistics, supplies and drugs. Next slide. They were managed by majorly in the start by the donation from our faculty, their relatives and other donors. Afterward, government and Director General Health Services and NDMA came forward and they arranged the things. Next slide. Donation Management Committee was formed under the leadership of Professor Tipu Sultan, and this worked very well. Next slide. Established PCR laboratory for all the investigation relevant to the patient suffering from corona. Next slide. Protocols and publication committee did a lot of work. CN started working over it and they did the guidelines for PPE, isolation, HDU and ICU for COVID. Handbook was prepared in the initial start. I worked on it, and the first handbook was prepared for management of patient for the COVID. Then a second issue was released in the July. And consensus statement for World Federation Association of Paediatric Surgeons to define the role of pediatrics in COVID-19 was written by me, and it was opted by World Federation Association of Paediatric Surgeons and published. Total 8 articles from scientific side and 5 articles from medical faculty was written over the COVID. Next slide. This is our first handbook. Next. Second handbook. This is World Consensus Statement. Next. And these are the articles written by our department. Next. Advisory for the surgeons and advisory for anesthetic was written and published in our journal of Adolescent and Pediatric Surgery. Next. Stoppage of routine work, this created a lot of problem. Resumption of work was started after 1 month, but our surgical and medical team, they continued throughout the duration. Next slide. Transport was arranged for the shifting of our staff. Next. Teaching and training was a serious challenge. We arranged 40 workshops, 12 for the general faculty, 10 for surgical faculty, 10 for nurses, 5 for the on the platform of PMA, and 3 webinars were arranged from the Children's Hospital Lahore. We also arranged at the platform of APSP. All the Zoom services were provided from Children's Hospital, and Children's Hospital arranged these meetings for the APSP and our pediatric surgeons also. Next slide. Educational training and workshop at Children's Hospital. This all work was done at our platform. Our staff was first trained by the government, then they trained our staff next for the management of patients. Online learning and training was used by our hospital, and so many workshops and teaching programs were designed, and they were then training of our other staff was also done. Next slide. These all were arranged from the Children's Hospital Lahore for our association. Next slide. Next. 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 We started our telemedicine services, and this was done under the leadership of Professor Arfan. Next slide. And total call received were 1050 in this, and 80% were relevant to the COVID. Upgrading of functionality of the hospital. Our medical emergency was upgraded. 40-bedded surgical nursery was upgraded, and our theatres were upgraded with the modular and laminar airflow, and we were able to reallocate funds for upgradation of our 11 theatres from the CAD, then first, then Secretariat, then from the Cabinet Committee. I highlighted at higher platform that when surgeons are not safe, they cannot be continued, and you will lose the surgical force in the end. Our 4 emergency theatres are upgraded. They are now modular and with laminar flow at the capacity of 58 cycle exchange per minute. This was inaugurated a few days back by CM, and this is our nursery theatre. New block theatres are in the process of upgradation. So we changed this situation in our favor. We upgraded our hospital. Monetary benefit to our workers was total doctors got monetary benefit of 142, nurses 144, paramedical staff 230. Vaccination. There was strict advice in the beginning that only limited number of persons should be vaccinated, registered for vaccination. But we insisted that our whole staff will get the vaccination. So our 3,690 workers were enrolled and registered for vaccination. This was the biggest number in Punjab. And out of this 3,915, they are vaccinated. What we learned from this pandemic, how to deal with this. We can deal with it by motivation, teaching and training, online learning, online international collaboration, research and publication, behavioral and lifestyle changes, effective communication, and new dimension of treatment, laid down by new dimension of treatment, and logistic and infrastructure changes and development, but be resident to off and mold to new dimension and new paradigm. Way forward. In the absence of definite treatment and vaccination, the most effective measure is to prevent the infection and to practice the norm of hand hygiene wearing the mask and social distancing. A most positive highlight of this present crisis is proactive role played at the level of medical/surgical faculty, journals in helping clinicians, scientists, sharing the experience, research, perspective and opinions to help the colleagues to gain confidence and manage their patients effectively and efficiently. Opportunities for a better world. Foresight of Corona, opportunities for a better world. A proposal for better world and opportunity not to be wasted. We should convert it in our favor and lay down, and this opportunity should be used for system change. Think globally, act locally. And impossible never existed. The COVID pandemic has given us a new purpose. We now have a rare opportunity to affect positive change beyond dialogue for creating awareness. It's time to develop and implement tools that empower us to take committed action and credible measures our progress towards affecting a long overdue transformation of our healthcare system. Power change. It was done 2 years back and today's again being changed. And we are leaders. There are so many leaders sitting among you, and you are leaders. And we will defeat Corona pandemic. Thank you all.